This is the time of the year that people are starting to go outdoors. Of course, not today, but as a general rule, many people are going in the woods, maybe scouting around their hunting stands, or they're scoping out the year's hunting possibilities. Some people are camping and hiking, and I've been getting a lot of questions about a very misunderstood illness, and I wanted to cover it today. That's Lyme disease. Some may not even know what Lyme disease is, and I've had lots of patients ask me about what it is and where it comes from and what we can do about it. And
Is it from ticks?
it is, and it's becoming more and more common because we're discovering that a lot more people may have this than what we originally thought. But in most cases, it's not a big deal. It's like you get sick for a few days, you can take some antibiotics and you're over it. But in some cases, it can become a chronic disabling disease called chronic Lyme disease. Now,
How do you know? What are the symptoms? How do you know?
well, it's very confusing actually about the testing and the symptoms and all that. It can be very hard to diagnose and hard to figure out what to do about. And it's even somewhat of a controversial illness in the medical field. Doctors can't seem to agree on anything when it comes to Lyme disease. You can ask 4 doctors and get 5 opinions about about what causes it, what's going on, how to treat it, how to diagnose it, and so it's pretty misunderstood. But Lyme disease comes from a tick that has been infected with a bacteria called Borrelia. And so as the tick bites you, the bacteria gets transferred to the human. And I've heard some doctors and researchers even may feel that other insect bites can cause it, like mosquitoes or other insect bites could cause it as well. That has not been proven in any way, but of course, I guess anything's possible, but it's just not known. But we know for sure that a tick bite infected with the Borrelia bacteria it can cause this. And now, not every tick bite causes Lyme disease. And in most cases, Lyme disease can be treated with medical care and never develop into anything worse. But in fact, there are over 300,000 cases of Lyme disease every year, and it's getting much more common. Not, I think, because there's more cases of it, but just doctors are becoming more aware of chronic Lyme disease, and that could be a possibility. Now, mostly this happens in the Midwest, but a lot of people from here travel up there to either deer hunt or travel up there on camping trips.
Did you ever get bit by a tick?
Not that I'm aware of.
Okay.
Yeah, so a lot of people maybe go up there to a national park, maybe Yosemite or something like that, or vacationing. And so you really want to be aware of this. But a small percentage of Lyme disease can develop into what's called chronic Lyme. And this is a very disabling disease. I mean, this can be debilitating. And it can lead to fatigue, joint pain, arthritis, brain fog. I mean, some really strange symptoms that can really be a chronic, long-term disabling condition. And
people may not know they have it?
Right. They don't know what's causing it. Maybe they got misdiagnosed with fibromyalgia or chronic fatigue syndrome, or maybe they were told they had chronic rheumatoid arthritis, and come to find out they actually have Lyme's disease. So it gets misdiagnosed quite often.
Is there a test?
Well, there's not a very reliable test. The test for this is very unreliable. The test looks for antibodies created by the bacteria, not the bacteria itself. So, in other words, when we get the bacteria, our body produces antibodies to fight the bacteria. Yeah. And the test looks for those antibodies.
Okay.
So we can get a negative test result even weeks after exposure to the bacteria. And we can also get a positive test when it's not present, when the bacteria is not present. So it's a little unreliable. There's no definitive way to say, yes, you have chronic Lyme disease in some cases. Now, sometimes you get a positive test and it's obvious that's what the person has, but not all the time. So the testing we have available right now is pretty unreliable. Now, there are a whole host of alternative labs and alternative doctors that are treating for this in other ways. But these tests have not proven to be truly reliable either. So there's a lot of, this is sort of a emerging trend in working on Lyme disease and treating Lyme disease. But the bottom line is it's really hard to diagnose. And here's the number one sign that you've been exposed to Lyme disease is you will get a signature bullseye rash around the tick bite site. So what that means is it is just what it sounds. It will look like a shooting target. So you'll have a red spot where the tick was, and then there'll be normal skin, and then there'll be a red ring around that, and then there'll be normal skin. There'll be a larger red ring around that. It looks like a bullseye, like a target, like a shooting target. If you see anything similar to this, go to the doctor right away. Find somebody that specializes or at least regularly treats Lyme and go see them. I know Dr. Cobb in town does a lot with Lyme patients, and so find somebody who has some expertise in Lyme disease and
what if it was like on your back and you missed it? You missed the rings.
Yeah. So the thing is, if you do get bit by a tick, you want to watch that area very, very closely over the next few weeks and make sure that you don't see any kind of these red rings around it. So,
and I'm guessing you would know it if you were bitten by a tick?
Well, you should certainly check. Anytime you come out of the woods, you should absolutely check for ticks.
It's not just the woods, though. It could be like in your yard, really.
Yeah, absolutely. Yeah,
there's a lot of people listening to this right now going, I will never get bit by a tick. I ain't going where they got ticks.
Right.
But the thing is, you could be out in just your yard.
Yeah, absolutely you could. Yeah.
How many dogs have you? Dogs all the time get them.
Right. And so you really want to watch this. This is not something that you want to have. So when we get back, I'm going to give you some treatment options and some tips on how to prevent this from happening to you and your family members and your kids. We'll talk about more prevention and treatment when we get back.